Retinopathy of prematurity, or ROP, is an eye disease that a lot of premature babies are susceptible to. When the baby is delivered early, the development and growth of the eye stops at that point. And then when the babies are exposed to different stressors, for instance, oxygen therapy, it stimulates a growth factor in the eye that begins new vessel proliferation. These new vessels that are forming are not normal blood vessels. The blood vessels that form in the eye are very leaky, and blood starts seeping around it, and eventually it scars and forms a fibrous tissue that can cause a lot of tension on the retina. If untreated, this disease can cause retinal detachment and blindness. This is probably one of the most common causes of preventable blindness in babies. What will most likely happen to your baby if they're born prematurely, specifically before 30 weeks or smaller than 1,500 grams, an ophthalmologist will visit them roughly between 4 to 6 weeks of life. They will conduct eye exams to determine whether or not the eyes have matured or if these blood vessels are causing a problem. There are a number of different ways to treat them. One, they may just keep an eye on your baby and follow them weekly or bi-weekly. Now, if they determine that these blood vessels are going to cause a problem, there's different types of therapy for it. One being laser therapy, or two being they can do a surgical intervention. A lot of research and studies are being conducted to determine how can we prevent retinopathy of prematurity. One of the things you may hear about is oxygen management. But retinopathy of prematurity is a very serious condition. If the ophthalmologist has decided that the baby needs outpatient follow-up, it is very important for parents to keep those appointments. You never want your child to go blind. This is a very preventable eye disease.